Hi, I'm Megan Kingsley Gale with the Hospital Practice Handbook Project, and welcome. Today I wanted to share with you about some information we have as we're preparing for a big Telehealth Roundtable event on June 20th. So this is just a little preparation to help keep everybody up to date about what we're working on and the information that will be presenting. So this is just some background information so that when you attend the event on June 20th, you'll be more prepared and be able to better engage in a lot of the discussions we will be having at that time. So today, I'm just mostly talking about the why telehealth and what I'm talking about when I am talking about telehealth and acupuncturists and hospital-based practice. So the two main things I'm going to talk about today is why is telehealth important as part of phased reopening, and what is the potential for telehealth for the integrative health paradigm of care, particularly for acupuncturists. So please save the date for the Telehealth Roundtable. It will be Saturday, June 20th from 9 to 11 Central Time. Again, that's Central Time Zone, US and Canada. And if you have questions for the panelists, please send them ahead of time. The Telehealth Roundtable panel is going to be on the 20th. So send in your questions before June 18th. And you go ahead and use the contact page on the website with the topic tag telehealth for your questions. That way I can get the questions to the panelists in a timely manner. All right, so please, this is how you get your ticket. So if this topic interests you, I highly recommend you come and attend the event, and you can't attend the event unless you have a ticket. You need a ticket to attend, and there are 3 ticket options, and I created more than one option based on feedback from the community. You can have there's a basic ticket, which is just a ticket to the live event. There's the Ticket Plus, which is your basic ticket plus access to the recordings, or just recordings. And again, there's that URL landing page for where to go to buy tickets. So why telehealth? So generally, telehealth has been around and accessible up to, within some parameters from Medicare for a few decades now. So just within the last few months, Medicare has opened up the guidelines so that people can receive telehealth at their home, and this is wonderful. This is one of the biggest barriers to telehealth, was that it used to have to be in a rural community, and then even then you'd still have to travel into a clinic location. But now you can receive telehealth in your home. This is wonderful. So generally, this helps with access to care for patients and providers. There's no limitation because whether or not you have transportation. And for example, if a patient lives far away and the travel time for appointments is excessive, especially when you're going to see a specialist, oftentimes like for a pediatric specialist, you may have to take your kid out for a whole day of school for an inpatient visit between traveling, getting to the appointment, waiting for the appointment itself, and then maybe some labs and follow-up afterward. Potentially with a virtual telehealth visit, your school-age kid could see their specialist and miss just a couple hours of school versus the whole day. And then there's that potential for having a connection to a local lab that's nearer to you, that's open on evenings and weekends, that would be able to communicate that laboratory information with your provider if you've got a system that has that capability. I realize there's all different kinds of variabilities in healthcare systems and accessibility. So that's a potential idea. But especially telehealth during the pandemic has really taken its stride because of stay-at-home orders, and organizations are adopting telehealth wholesale to help deal with the stay-at-home orders. It allows providers to work remotely. It allows healthy providers who are quarantined, who are still able to provide clinical care because of telehealth. Healthy patients who are quarantined still have access to care. Sick patients who cannot attend clinic in person can still receive some health care. Providers with school children at home, because schools are closed, can still do some part-time work remotely because telehealth allows for that remote work option, as well as maybe some other remote work options. Providers who are high risk themselves can remote work because of telehealth, and providers who have dependents who are high risk can remote work with the telehealth tool. So telehealth in the pandemic, some benefits of telehealth specific to this respiratory virus, COVID-19 pandemic. And these are quotes from a new article that was published last month. And I'll show you the citation in a couple slides as well. Healthcare systems with telehealth sustain the continuity of patient care during this pandemic in the midst of stay-at-home orders and physical distancing measures, while reducing community and nosocomial, that's clinical or hospital-based spread. And for inpatient care, telehealth can help balance the supply of clinical services with surge in demand across physical or geographical boundaries. It helps conserve personal protective equipment, and it helps provide isolated patients with a connection to their family and friends, as well as to providers. And for an example of that, I recommend Paul McGee's presentation. We have a preview of that loaded up to our Hospital Handbook Project YouTube page, and about his work, his program's work at Allina for their inpatient telehealth visit. And he will also be one of our presenters at the roundtable. So why a telehealth event? Why a telehealth roundtable? So why this event? The Hospital Handbook Project, I've been hosting community discussion space on live and in live Zoom session at least weekly since mid-March for the hospital-based practice acupuncturist community to provide space for discussion, problem solving, sharing examples of innovation, as well as how we all respond to the pandemic in our various programs and through different stages of closing and opening across the country. And the content for those community discussions, if you're interested, we do have an online resource module for that. But out of these sessions came a very consistent need to do even more, particularly to host our own conference on telehealth. But just the community discussions and the Zoom sessions wasn't enough. There was a request for an online event. So I have set one up for you all. So why a telehealth event specific to hospital-based acupuncture programs? Telehealth capability, as you all know, is critical for all clinicians in the phase clinical opening, closing as communities respond to the pandemic. And some organizations had a program in place before the pandemic, but many stood their telehealth program up during the pandemic as a way to support and protect both provider personnel and patients during a respiratory-based pandemic. And some programs are still in the process of standing theirs up and are looking to the community for examples to match their system. And that's why it's great to have a variety of examples, because not all systems are exactly the same, obviously. However, not all systems have been supportive or understanding of how acupuncturists can work via telehealth versus in person, citing lack of access to current examples. So here we are with the roundtable event presenting current examples of telehealth programs in hospital-based acupuncture practice. And we're having a professional Socratic discussion on the related topics. So please join us for the roundtable. So a little bit about defining telehealth. So I'm going to take the definition from this article that was published in May, and this is the same article I referenced a couple slides ago. And this is the best definition I have come across to properly discuss what I believe telehealth is. And when people refer to telehealth, it really is covering the spectrum of activities used to deliver care at a distance without physical contact with the patient. Telehealth encompasses both provider to patient and provider to provider communications. It can take place synchronously, telephone call, video call, asynchronously, patient portal messages, email consults, electronic virtual consults with other providers, and through virtual agents. For some systems have chatbots enabled or wearable devices, which goes into the subcategory of telemetry. And there's the citation for you there. So I have heard this discussion about telehealth versus direct patient care. And I have to tell you guys, this is a false comparison. The argument is not telehealth versus direct patient care. The true comparison is clinical care versus no clinical care. Let me give you the example and this is because we have the gift of tech in this day and age. We have the gift of technology, and technology for clinical care right now is telehealth. So let me give you the example in my life of active duty military family. So before the gift of technology, email, phone calls, we had letters, and as you guys know, I am a spouse of active duty service member, and he has more than 20 years of service. And when we first started dating, we had letters. And letters is a great way to communicate. But when email came along, that was even better. And then when we were able to go from radio phone calls only to the potential of even being able to use a cell phone in port calls, that was a big thing. So being able to communicate with a loved one, with our service member using technology, was way better than no communication at all. Now, having a phone call or email from our service member, our loved one, is not the same as being able to see them in person, to give them a hug, to have dinner with them. Technology is not a replacement for that. Just like telehealth is not a replacement for direct patient care. So that's my example. All right, so I want to propose to you a telehealth model. Oh, excuse the glitch here. Here we go. A telehealth model for integrative health. So as those of you who work in integrative health know, we, especially as acupuncturists, our work is just essentially patient-centered care. That is just how it's always been, and it's not a switch for us to go from non-patient care to patient-centered care. We've always done patient-centered care. It's integral to the work that we do. So telehealth is a vehicle to support patients in their positive lifestyle changes. We can help encourage them in self-care practices such as movement, TCM dietary therapy, lifestyle changes such as tobacco cessation, and telehealth can be part of your functional rehab and or functional recovery model, which is the new pain management model. And if you're interested in more in that, I have other resources about that model of care. And telehealth has the potential for patient engagement in their health by having access, and potentially more frequent access, to their providers and to supplemental resources, whether it's webinars, handouts, or just regular check-ins. So there's potential in telehealth for integrative health providers, and this is some of that potential. And some of you may already know this, but I just want to lay this out and try to be as clear as I can about this, and use a couple of examples to tell you what I'm talking about when I talk about acupuncturists have more in their toolbox than direct patient care. So we have the ability to do one-on-one care as well as group sessions, and that's the same for one-on-one telehealth and group telehealth sessions. So for example, for one-on-one care, we can do individualized sessions specific to the patient's presentation of their condition, from teaching self-care in like self-care acupressure, self-care tuina, movement, tai chi, qigong, breathing techniques, etc., to prescribing traditional Chinese medicine dietary therapy, individualized sessions with updates to follow up, updates with the patient to follow up, and or also known as check-ins. We can do individualized TCM dietary therapy to support pain management, decrease pain, decrease inflammation, support the constitution. And that can also work for other conditions such as migraines, poor sleep, stress, anxiety, and other things. We can prescribe Chinese herbal medicine, individualized prescriptions with follow-ups or check-ins. And Galina Rufiner has a presentation. She will be presenting on telehealth and CHM at the Roundtable event. And again, all these things, always watch whatever you're doing, whenever you practice, watch your state scope of practice and your facility scope of practice as well. Group telehealth, webinars, group classes you can have webinars or group classes on general wellness or for a common condition, for example, low back pain. You could be in group telehealth, you can be demonstrating acupressure, tuina, movement, tai chi, qigong, breathing techniques, etc. Or you could be doing group telehealth to teach TCM nutrition basics for wellness or a common condition, such as a chronic pain condition. And if your program already has some really cool other programs going on, some complementary programs, possibly maybe you'd be able to coordinate with the nutrition department classes or the teaching kitchen collaborative program that you have going on. And maybe even those programs have something cool going on where they're teaching about healthy nutrition, and maybe even have programs where they can give patients access to food, grocery delivery service. You never know. You never know till you ask, right? So here's an example of telehealth for TCM providers, acupuncturists, setting patient-centered goals. And remember your motivational interviewing training. If it's been a long time since you did your motivational interviewing training, I recommend doing some CEUs to catch up on that. You're teaching self-care, you're prescribing movement, TCM nutrition, acupressure. If you're nationally board certified, NCCM board certified in herbs, you can do Chinese herbal medicine. If it's also in your local scope of practice, you can do scheduled check-ins with follow-up questionnaires. So remember, metrics, whether it's direct patient care or telehealth, you still need to be using metrics. That is a basic part of professional practice. So I have been hearing about scheduling just one telehealth visit. Don't do that. So you wouldn't just schedule one acupuncture visit, right? You would schedule multiple visits as part of a bigger treatment plan. So don't just schedule one telehealth visit with your patient. You should have multiple visits scheduled as part of a bigger treatment plan for their presenting condition. So for example, a telehealth initial 6-week program with check-ins would have a reevaluation set point in the middle of that session where you reevaluate, see how things are going. Goals would follow an individualized patient plan, mini goals that help, teaching self-care activities that we're moving toward those patient goals, so steps that help you get toward that main goal, teaching self-care along the way. Check-ins to review what the patient learned, add, modify to that self-care routine. If the symptoms aren't controlled with the recommended self-care or the patient is not complying with the self-care routine, you can triage for in-person treatment and or end of care, ending the care or referral. It kind of depends on what's going on. That would be a good time to reevaluate. Note your treatment goals. For example, for functional improvement, you could be teaching a Tai Chi routine for low back pain and be telling the patient, okay, you need to do this low back pain routine Tai Chi daily for 2 weeks. And then I want you to check in via a virtual visit appointment with me on this date. And then you'd also be giving your patient at the initial and the check-in, be giving them paperwork to complete and submit, like Oswestry Disability Index, which is a subjective questionnaire that has been validated by research for low back pain. And then you could potentially send the patient videos and or YouTube tutorial to follow along with their low back pain Tai Chi routine so that they would have something when they're practicing twice a day, that they have something to follow along with, whether it's a video of you or a video of your colleague doing that routine for consistency. So, do you have questions for our telehealth panel? If you do, please submit them to our website contact page with the topic tag telehealth. And this is how you reserve your ticket. Again, we have those 3 ticket options, and the landing page is on our website there. And one extra thing we have going on this summer, we do have a community survey, and this has been requested by the community. And it's just an online Google survey. You follow the URL there or type it in. So this URL goes to a blog post on our website that is a blog post for the month of June. So if you want to go to the Hospital Handbook Project blog, the blog 01.thehospitalhandbookproject.com, and you go to June blog posts, there'll be one on phased opening, closure, and remote work survey, and it'll have more information about the survey and the link to the survey. And the survey is just kind of checking in, like, where are you in your program at in the phased reopening, closing during the pandemic. And the survey is, you have the options to go back and edit it because things are changing quickly. So if you answered something, today and then, 2 weeks, 4 weeks from now, it is a different answer, you can go back and edit that answer. And some of the questions that are on that survey are about work status, between remote work, telehealth, furloughed, etc. What opening and closing, phase reopening looks like, infection control routines that you have in place, personal protective equipment types and uses, if you're doing webinars, other remote work stuff, other direct patient care changes that you've had going on, and a few other things. So these are some other ways you can support this community resource. Obviously, today I'm talking about our roundtable event, and I encourage you to buy a ticket. But if you feel like that's not for you, you can. These are some other options to support this work. Again, I am 100% volunteer. My work and time is 100% volunteer. So anything that you support for this resource goes directly into the resource to making these things possible, such as the roundtable. So we have a supported community discussion option. The virtual coffee option is always available on the website. And one of the newer things we have going on in 2020 is the Issues in Hospital-Based Practice webinar series. And parts of the Telehealth Roundtable have been part of that, some of the earlier sessions that we did. All right. Well, thank you all very much for your time today. I hope you found this helpful.